Hello everyone, welcome back to my channel. Today we are going to learn one of the most important topics in healthcare, infection prevention and control. This topic is essential for all healthcare workers, especially respiratory therapists, because we handle high risk patients and equipment daily. So let's begin the chapter. First, we'll learn Introduction to Infection Control. Everyone should know what is HAI. HAI means Healthcare Associated Infection. Healthcare associated infection can occur in two main ways. First is community onset infection. Second one is hospital onset or nosocomial infection. Now let's see what is community onset infection. Community onset infection means that starts outside the hospital. Let's see a simple example for community onset infection. Take a family, consider that father has a ringworm infection. If any of the family member uses the object used by the father, then there is a high chance that they may also get infection. Next is hospital onset or nosocomial infection. Infection that develops inside the hospital, usually after 48 hours, is known as nosocomial or hospital onset infection. A very common example for hospital onset or nosocomial infection is Pseudomonas aeruginosa. Pseudomonas aeruginosa is a common cause of hospital acquired pneumonia. It is rarely seen in community acquired infection, which is why infection prevention inside the hospital is extremely important. Now we'll learn which are the elements that must be present for infection to spread. First element is source, second element is root, third element is host. Now we'll learn source of infection in detail. We know that sun is the source of light. Likewise, we will see which are the sources which can spread the infection. In hospital, infections can spread from four major sources. First one is humans as the primary source. Now we'll see which are they who can spread infection. For example, patients, healthcare workers, and visitors can all transmit infection. This is why hand hygiene is important before and after touching the patient. Second one is inanimate object. Inanimate objects are the objects which are nearer to the patient. For example, medical equipment, bed linens, and even medications can become contaminated if not handled properly. This is why disinfection and sterilization is very important. Third one is patient environment. Patient quickly contaminate their surrounding such as bed rails, call bells, tray tables, and bathroom become high-touch surfaces. Fourth one is endogenous source. Sometimes patients themselves are the source. Their own natural bacteria called endogenous flora can enter sterile areas of their body and cause infection. Next we'll see second element host in detail. We will see which are susceptible host. The person who are more privileged to get infection are known as susceptible host. Susceptible hosts are of two categories, non-modifiable and modifiable. First, we will see non-modifiable risk factors. First one is extreme age, newborns or elderly. In newborns, immune system is not developed fully, so they are at high risk to get infection. And in elders, their immunity decreases as age passes, so they are at high risk to develop infection. Next is poorly controlled diabetes, HIV or other immunocompromised conditions, patients on chemotherapy or TNF inhibitors. TNF inhibitors means tumor necrosis factor inhibitors. I will give a homework. Read about TNF inhibitors. Next is modifiable risk factors. Modifiable risk factors means this can be controlled. Use of medical devices like urinary catheters, central venous catheters, and endotracheal tube. These devices bypass natural body defenses and allow bacteria to form biofilms. I will give a simple example for biofilms. If you store water in a bucket for many months, you will see a thin slimy layer which is known as biofilm. It is due to development of bacteria in the water. However, use of these devices cannot be avoided, but infection risk can be reduced by proper insertion, maintenance, and timely removal. Next, we'll see route of transmission of infection in detail. There are three major routes of transmission in healthcare. First one is contact transmission, which may be direct or indirect. Second one is droplet transmission. Third one is airborne transmission. Now we'll see about contact transmission. Contact transmission are of two types, direct or indirect. Direct means touching the patient. Indirect means touching contaminated surfaces or equipment. This is actually the most common route of infection. Second is droplet transmission. Larger respiratory droplets greater than 5 microns travel up to 6 feet during coughing, sneezing, or talking. For example, diseases like influenza, pertussis spread this way. Third route is airborne transmission, where very tiny particles less than 5 microns remain suspended in the air for long periods and can travel longer distance. For example, tuberculosis, measles, and varicella. I have put this chart from eGuns for your reference. Now let's see strategies to prevent infection in hospital. First is safe environment. Patient surrounding clean. Keep proper ventilation by installing many windows. Regular disinfection of the surface. Next is immunization of healthcare workers. All healthcare workers should receive hepatitis B vaccine, varicella vaccine, pertussis booster, annual influenza vaccine. Hepatitis B vaccine is given to protect from hepatitis B infection. Varicella vaccine is given to prevent chickenpox. Pertussis booster is given to stop whooping cough. Annual influenza vaccine is given to prevent seasonal flu. Next step in infection control is eliminating the source of pathogen. This is done through proper sanitization and equipment processing. You should remember these four key terms. Bactericidal means kills bacteria. Bacteriostatic means stops bacterial growth. Sporicidal means destroys spores. Virucidal means destroys virus. Next we'll learn about cough etiquette. Cough etiquette is extremely important, especially in cough clinics, emergency rooms and OPDs. Guidelines for cough etiquette are cover mouth and nose while coughing, use tissue or elbow method, put a surgical mask on coughing patient, perform hand hygiene after contacting secretion, maintain at least 3 feet distance from people with respiratory infections. Next we'll learn about equipment processing. Respiratory therapy involves multiple reusable equipments like nebulizer, tubings and ventilatory circuits. These must be disinfected properly. Based on this chapter, common high-level disinfectants include 2.4% or higher glutaraldehyde, 0.55% OPA, peracetic acid, 2% hydrogen peroxide. These agents kill bacteria, virus and sometimes spores depending on concentration and exposure time. Thank you guys for watching this video. In next video we will learn about WAP bundle and hand washing steps. Till then, like, share and subscribe.